Welcome to today's lecture on ICD-10-CM conventions and general coding guidelines. In this session, we'll cover the essential rules and principles you need to follow when coding with the ICD-10-CM system. These conventions and guidelines are the foundation for ensuring accurate and consistent coding, which is critical for everything from patient care to billing and reimbursement. By the end of today's lecture, you will be able to understand the importance of conventions and general guidelines in ICD-10-CM. Apply these conventions and guidelines to coding scenarios. Recognize when to refer to official coding guidelines to resolve more complex issues. Why conventions and guidelines matter. ICD-10-CM is not just a list of codes. It's a structured system governed by specific rules and guidelines. These ensure that we code diagnoses accurately and consistently. Coding incorrectly can lead to errors in patient care, claims denials, and even legal issues. That's why conventions and guidelines are non-negotiable. They provide the roadmap for how to navigate the system properly. The rules fall into two broad categories: conventions and general coding guidelines. We'll explore each in detail, and by the end, you'll have a clear understanding of how to apply them in your coding practice. Let's start with conventions. These are the specific instructions within ICD-10-CM that guide how to look up and apply codes. These conventions are mainly found in two parts of the manual: the alphabetical index and the tabular list. The alphabetical index is where you'll start your search for codes. You find the main term for the diagnosis, then follow any subterms that refine your search. The alphabetic index is in the front of our coding manual. The terms are listed alphabetically and very similar to the same concept of using a dictionary. After identifying a potential code in the index, you must confirm it in the tabular list. You will never code directly from the alphabetic index. After you find a code, you must look it up in the tabular list. This section is organized by chapters based on body systems or disease types. The tabular list is where you'll find critical additional details, such as code extensions and exclusions. Let's talk key conventions. First, we have abbreviations. The abbreviation NEC, not elsewhere classified, is used when a specific diagnosis cannot be found. Basically, it is not in the coding manual. The abbreviation NOS, not otherwise specified, is used when the documentation doesn't give enough detail for a more specific code. Punctuation. Brackets, used in the tabular list to enclose synonyms or alternative wordings. Parentheses, used in both the alphabetical index and tabular list to enclose supplementary words that do not affect the code. Colons indicate that additional terms are required to complete the code. Now let's move to the includes/excludes notes. Includes provides more clarity on what is covered under a specific category. Excludes PMO, ASD, excludes TU are important distinctions. An excludes one note means that the conditions listed cannot be coded together. Excludes two means that a condition can be coded alongside the main code if the documentation supports both conditions. By understanding these conventions, you ensure that you're assigning the correct codes and applying the appropriate detail. The guidelines have their own table of contents and their own page numbers. Note that the page numbers have a G in front of the page number. Be sure to tab your guidelines so you can access them quickly and easily when coding. While conventions guide how to use the ICD-10-CM manual, general coding guidelines provide the bigger picture rules on how to code diagnoses. These guidelines are found in the front of the ICD-10-CM manual and cover essential principles that apply across different coding scenarios. When testing, oftentimes code selection depends on the coder paying attention to details and reading carefully. You have to read everything. This may seem daunting in the beginning, but the more you practice, the more you train your eyes what to look for, where to look, and where to focus. In the beginning, we focus on accuracy. Speed will come in time with practice. There are key areas covered in the general coding guidelines. 1. How to sequence codes. 1. The primary diagnosis is always listed first. 1. This is the main reason for the patient's encounter or treatment. 2. Secondary diagnoses follow in order of importance or relevance to the encounter. For example, if a patient is admitted for pneumonia and is also treated for hypertension, pneumonia is the primary diagnosis and hypertension is secondary. 2. How to report additional diagnoses. 1. You may need to code for multiple conditions when relevant to the care provided. 1. Always capture coexisting conditions that affect treatment, such as diabetes or heart disease. Use the guidelines to determine which conditions need to be reported in addition to the primary diagnosis. 3. Outpatient versus inpatient coding. 1. Inpatient coding focuses on longer-term care and may involve coding procedures in addition to diagnoses. 2. Outpatient coding often involves using ICD-10-CM alongside other systems like CPT for procedures. The general coding guidelines specify which codes apply based on the setting and patient encounter. Always consider the episode of care. 3. Is it an initial encounter, a subsequent encounter, or a follow-up? Guidelines help you determine which to code. Now, let's take a real-world coding scenario to see how these conventions and guidelines work together. Imagine you're coding a case where a patient is diagnosed with type 2 diabetes and presents with diabetic retinopathy. Start with the alphabetical index to find the code for diabetes. Look under diabetes. From the subterms, you find with retinopathy. Next, confirm the code in the tabular list, ensuring that you check for any excludes 1 or excludes 2 notes. Now, apply the general coding guidelines. Since this is an outpatient encounter, you would code for the diabetes first, followed by the retinopathy as an additional diagnosis. By following these steps, you ensure that your coding is both accurate and compliant with ICD-10-CM guidelines. Referring to official guidelines for complex issues, sometimes you'll encounter coding situations that aren't clear-cut. This is when you need to consult the official ICD-10-CM guidelines. For example, when coding complications or sequelae, late effects, the guidelines provide specific instructions on how to sequence and report these conditions. Complex cases, such as multiple chronic conditions or unclear documentation, may require you to review the general guidelines thoroughly to ensure accuracy. When in doubt, always refer back to the guidelines at the beginning of the ICD-10-CM manual. They are your ultimate reference for resolving complicated coding issues. To wrap up today's lecture, remember these key points. 1. ICD-10-CM conventions govern how you search for and apply codes in both the alphabetical index and the tabular list. 2. General coding guidelines provide the essential rules for sequencing diagnoses, reporting additional conditions, and applying codes in different healthcare settings. 3. Always refer to the official guidelines for complex coding issues, ensuring accuracy and compliance. By understanding and applying these conventions and guidelines, you'll ensure that your coding is both accurate and reliable, supporting patient care, billing, and healthcare operations. When going through the course and throughout your careers, remember to practice applying the conventions and guidelines we discussed today. Accurate coding is so important. Thank you all for your attention today, and I'll see you next time.